Hey folks, welcome back to Bridging Hope, Connecting Mississippi. I'm Daniel Gallarno. Today we're going to be talking with Chad Allgood, who's the Division Director of the Division of Early Childcare and Development. We're going to talk with Chad about some important projects they worked on during the COVID-19 pandemic and also about some policy changes and projects that they're working on going forwards this year. Stay with us. We look forward to talking with Chad here momentarily. Hey everybody, Daniel Gallarno again here with our Division Director of Child Care, Chad Allgood. Chad, thank you for being here.
Thanks for having me here.
Yeah, absolutely. So before we get into some of the stuff that the division has been working on the last 3 years and some of the new changes, can you tell us how you got involved in early child care space from your start?
Yeah, so it's interesting. It was completely an accident. Back when I was in college, I was looking for a part-time job, as college students often do, and I happened to get connected with the lady who was looking for a 3-year-old teacher. And so I called my mom and I said, well, Mom, I found a job. I'm going to be teaching 3-year-olds. She started laughing. I had never really spent any time with children, but I started the job. I fell in love with the field really, all these years later, I've worked in different positions. I've been a teacher, I've been a director of a child care program, I've done training for child care directors. I've also been involved, prior to my position here as director of the Division of Early Childcare and Development, I worked at the Mississippi Department of Health, and I was over the child care licensing program. So got to see, I've been involved with the quality piece of it, I've been involved with the regulation, and now, my position here, it's really about driving early childhood policy that's going to benefit early childhood education and then the children and families that are served by that industry.
It's an impressive background, and it seems like you've had an opportunity to really explore the breadth of early child care in Mississippi and now apply that to the division director role. You've got the knowledge from the centers to the licensing and now the policy development at MDHS. It seems like you really have a well-rounded background.
Yeah, and people, early childhood, when you think about young children, you think about fun, playing, excitement, joy, and those are definitely all, that definitely captures the essence of what early childhood education is, but a lot of people don't really understand how complex the early childhood system is, because unlike other systems, even when you look at like the K through 12 arena, there are existing supports. There are existing institutions that that push the K through 12 education system forward. We don't really have anything solid in the birth to 5 realm, and each state is approaching their early childhood system building differently. And so when you kind of really dive into that and you dive into the policy, the procedure that drives an early childhood system, it gets, the waters get deep very quickly. But that's all part of what we do, is we help navigate, through those complex decisions, and again, trying to do what's best for Mississippi's children.
That's certainly a lot of information. And you said something that kind of links to the next topic I want to talk about. Things that states do differently when it comes to early child care and development. 36 months ago, in the heart of the COVID-19 pandemic, the federal government passes the CARES Act in addition to ARPA, and a lot of that money comes to the Division of Early Child Care at MDHS, over $300 million. Mississippi, in your division, elected to not farm that out to a contractor, which really fills me with a sense of pride when I get to tell folks about it, because we didn't waste any money administering this program. It all went to our child care providers. I know that was incredibly hard for you and your team with the administration of that. $300 million plus new dollars to get out quickly. Will you talk with us about what that money did for child care providers in the state and the impact it had on your team?
So the American Rescue Plan, there was a portion of funding. Mississippi was given $319 million for, and it was to go directly to help stabilize child care amid the pandemic. Many child care providers, despite the literal danger that there was in staying open, they met that danger head on. They stayed open. They continued to care for children. And many of them even extended their programs and opened their doors to school-age children who would normally be in school. But a lot of the school districts across the state, they closed their doors. They were still doing virtual learning, but there wasn't anywhere physically for the children to go, and those parents who couldn't shelter at home because they had to go to work, they turned to their child care providers and said, we need somewhere for our kids to go. A lot of those providers said, sure, we'll make accommodations. So the stabilization funds, we called it the Child Care Strong grant. And the reason why we called it Child Care Strong is because our workforce is only going to be as strong as our child care industry. Child care is literally one of the key backbone supports for Mississippi's workforce, and so we named the grant Child Care Strong. Like I said, we were given $319 million. We actually used additional funds from the CURSA money that we got, and we pushed out a little over $350 million within a period of about 6 months.
Wow.
And so we did all that internally. The folks in my division handled that. The federal government did give us the option of using up to 10%. So that would would have been approximately $30 million.
A lot of money
that we could have used to administer the program. We could have outsourced it. We could have gotten a contracting agency or organization to administer the grant. But because we felt it was very important for, as you said, all of that money to go directly to child care folks that were working so hard and literally putting their safety at risk. We wanted to support them as much as we possibly could. We also wanted to create a situation where any child care provider that chose to apply for the grant funds would be able to receive a grant. And these were fairly large-scale grants. Some of our larger programs across the state got upwards of $500,000.
Wow.
Now, we broke that down over a 6-month period, but it was still a good bit of funding coming in, and there was a lot to do with making sure that we were allocating the right amount of money. We based it on the operations of the child care program. So how many children they cared for, what the size of the program was, the area of the state that they were in, if they served children with special needs, if they served, if the families that they served were at a certain level of poverty. These were all things that we enhanced their payments. And then, of course, there was reporting that goes along with it. So it was a heavy lift, and I can just tell you that there were key people in my division that dove into the funding, the requirements for the funding, the reporting, and mapped out from start to finish what that application process was going to be, what the reporting was going to be, the follow-up. It was a difficult task, but I can honestly say, going back, would we do it the same way? I would say so, because again, all of that, we could have used, some of the money for administrative purposes, but we chose not to, because we really felt that we needed to do right by the child care providers that were so dedicated to the children that they were caring and educating.
Stories like that give me such a sense of pride to work here, and thanks again to you and your team for those decisions and that administration. I mean, that's very complicated and very difficult technically, so we really appreciate that. And to back that up, in this post-pandemic world, you've made another policy change that really is going to positively impact our mothers and our workforce in Mississippi. We'd love to hear about this policy change that the division's just embarked upon.
So one of the requirements up until we did make the policy change was any parent, guardian, et cetera. Primarily, it was single moms that were applying for the program. They were required to cooperate with our child support division, and I think that it's the work that our child support division does is extremely important. Taking care of your child is a fundamental responsibility of parents, and this policy change in no way reflected in any way that was not how we felt. But when we looked at the data, there were I think, and there are, again, particularly single moms out there that were fearful of, engaging in child support enforcement for different reasons. Some of them had been, victims of domestic abuse, and reconnecting in that way, or potentially reconnecting, with their child's father, might have been hindering them from applying for our program, because to apply they would have also had to done the cooperation piece with child support. And so we really felt like, at the end of the day, our program, the child care payment program, is primarily about supporting working parents, guardians, or parents that are in school full time. None of our participants are just sitting at home collecting money.
Right.
Furthermore, the money that our program sends out doesn't go to the parent. We pay the child care tuition on behalf of the parent. The parent chooses the program, the child care program that they want their child to attend, because that's their right. They have that choice of choosing where they want their child to go. But we pay the child care program for the family, so the funding doesn't even go to the family. The funding goes directly to the child care program, and the child care program is responsible for reporting attendance, etc., to make sure that again, it's not just money that's going out there and not being put to good use.
Right.
So we elected to remove the child support and cooperation policy, because we felt like at the end of the day it wasn't really doing anything but keeping those, again, primarily those single moms who needed that additional support. They can't go to work, they can't go to school. If they don't have a safe, nurturing environment for their child to go to day to day, and they're not going to be able to better themselves, they're not going to be able to get back on their feet unless they have that support. And we really felt that it was just ultimately hurting the mother, and then of course hurting the child who was not able to go to a high quality early childhood child care program.
And you've got some impressive data now in the last 10 days, I believe, that really shows the impact this has had on moms who want to get back out there, get some child care if they need help getting back to the workforce. Could you tell us about that?
Sure. The policy went into effect May 15th. That was when it was effective. And we wanted to see if that policy change was going to yield some positive results. So we've been watching our applications that have been coming in. So we're just at maybe 10, 11 days now. Mm-hmm. Just in those 10, 11 days alone, we've taken in over 1,600 new applications. And that's even more than we typically take in an entire month.
That's incredible.
Or, prior to the policy change. So I do feel that those numbers, I do feel that some of that is due to that policy change, which lets me know, or leads me to believe that we made the right decision.
Absolutely. And in the last 3.5 years for the Division of Early Childcare has been difficult. Y'all keep finding wins in hard places. You've given yourselves big shoes to fill. What do you see next in the division that's coming around the corner that y'all are excited about?
We've got some additional funding that was part of the American Rescue Plan. It's just shy of $200 million.
Wow.
And since the pandemic began, we've been trying to make more of an intentional effort to talk directly to our child care providers. We do meetings every quarter where we allow them to ask us questions, to give us feedback. We've been doing several series of town hall meetings where we're literally going out and we're meeting face to face. We're also doing some virtual, we have some virtual options to hear from them about how we can use this funding to uplift what they're doing day to day. And based on that feedback, we are going to be putting some support programs in place using those relief dollars. Now, these are temporary because the relief funding is also temporary, but I think we're going to show that through some of these programs, we're going to see some improvements in our child care field. So, for example, we are going to be raising our reimbursement rates, and we're going to use some of the relief dollars while we have access to it We are going to be raising our rates across the board, roughly 25%, with each age group that we serve. And then we're also going to be putting a scholarship program into place. So early childhood teachers will be able to use the scholarships toward a credential that is specifically designed for teachers that work in early childhood education. Tied to that, we're going to be offering an incentive bonus to those teachers. Wow. So, as a reward to them for, taking the initiative to further their expertise to where they will be better equipped, when they're in the classroom and when they're teaching children. We're also going to set up a substitute pool, which is something that's never been done before.
Wow.
A lot of child care programs, when they have absences, they have to look to their existing staff, to try to cover those classrooms, which can represent a real burden. And unlike, again, most school districts have substitutes, that they can call in, most of our child care providers don't have that luxury. And so we're going to be setting that up where they will have a pool of substitutes that they can use if there are absences, to try to lessen some of the administrative burden on them, but then also the additional burden that their teachers who might be asked to cover more or teach more children than they're used to, or what have you. Another thing that we're really looking at is the capacity. And when I'm saying capacity, I'm actually talking about where we do or do not have access to early childhood education across the state.
Okay.
So in the birth to 5 continuum, parents, again, depending on what their socioeconomic status is, they have a few options. They always have the option of child care if it exists. If there is a child care program, then there's some other things: Head Start, Early Head Start. There's pre-K collaborative classrooms that are popping up across the state, and those are all great. But child care is usually the first line. When a parent needs. A parent is working, they need somewhere for their child to go during the day. Child care is usually where they go first.
Right.
There's the last that I looked, there was a little over 120,000 children that were enrolled in child care alone.
Wow.
And when you compare that, like Head Start, the numbers are roughly between 25 and 30,000. So you're literally talking about 4 times as many children in child care. Well, there are parts of the state where we don't have child care. Parents don't have any options. And so we have identified 15 counties specifically that we're going to be offering startup grants for people that may want to open a child care program. And we really are focused on increasing the capacity for infant toddler care. That's a big need of parents across the state, caring for children that have special needs, because that's something else that is really, really crucial. And then those areas of the state, and again, we identified those 15 counties where the poverty level is really extreme. And so, looking at those 15 counties for the startup grants, but then statewide, we're going to be offering expansion grants. So if an existing child care program wants to make some changes to their program, some upgrades, if you will, to serve more children, to maybe open an infant toddler classroom, maybe they want to expand some of their services that would include children that have special needs. If there are child care programs that have parents that are working third shifts, if they want to offer extended hours, these expansion grants will go to help them on that front.
I don't think anyone can say y'all are taking easy wins. These are large, transformative undertakings, and makes me personally proud to work at MDHS. So thanks to you and your team for all y'all have done, COVID, post-COVID, and looking forward. Chad, thank you so much.
Thanks, Daniel.
Folks, thanks so much for joining us on another episode of Bridging Hope, Connecting Mississippi. I've been your host, Daniel Gallarno. We look forward to you joining us next time, where we will be exploring more of MDHS's services. Thanks so much. Take care.